Hello and welcome to AIDS 2024 Day in Review from Munich, Germany, brought to you by Plus Life and Gilead Sciences. I'm Karl Schmid. It is day 2 of the conference, and if the last 24 hours were anything to go by, we are in for an exciting and, at times, highly emotional rest of the week. I'll have some highlights for you in just a moment. And coming up, I'm sitting down with Danielle Campbell from AIDS Clinical Trial Group, Lilian Moreko from the International Community of Women Living with HIV Eastern Africa, and Alex Kintu from Gilead Sciences to break down what a person-centered approach to HIV research and care really looks like. And then Felipe Regato from Gilead Sciences joins me for a one-on-one conversation about putting people first when it comes to HIV. But first, as promised, here's a look at some of the highlights from the past 24 hours at AIDS 2024.
Members of the trans and gender diverse communities made their voices heard during yesterday's official opening ceremony of AIDS 2024.
Why did you pick this moment? Why was it important?
Because actually, for those of you who don't know, right before, during a couple of days, we were having a huge global trans conference with more than 200 organizations represented, and collectively we brought together an agenda that we felt was the right place to show and to showcase.
Demonstrations aside, German Chancellor Olaf Scholz helped kick things off and get AIDS 2024 officially open. With the theme of putting people first, the WHO laid out its new HIV guidelines with a focus on sustainability, monitoring disease control and elimination.
How can we look across the board at all the diseases that are either on a pathway for control, for elimination or eradication?
And class is in session. The world's top HIV and AIDS experts head back to school for U equals U University.
If you want to know anything about HIV, it would be U equals U because it gives you hope. It gives you a template, like, so, you know, I just take my meds. If they could be once a month, awesome. If they could be once every 6 months, even better. But if I take my meds, even just every day, I don't have to worry about anything.
So much great information already being shared here at the conference so far. Now, as I've said before, the theme of the conference is putting people first. But what does that mean? What does person-centered HIV care look like? Well, joining me to have a conversation just about that is our good friend Danielle Campbell from AIDS Clinical Trials Group and Lilian Moreko from the International Community of Women Living with HIV Eastern Africa, and from Gilead Sciences, Alex Kintu. Thank you all for being here, making the time. I want to start with you, Lilian. We talk about putting people first. What does that mean, and how important is it for those of us, like myself, living with HIV, those within the community, that we're represented and we're heard, especially when it comes to trials and clinical trials like that?
It means you put me first. I'm at the center. My priorities are the first that you consider. So for whatever you're planning, I must be at the center and I must be involved from the beginning. Meaningful involvement, engagement, and ensuring that whatever you determine or you decide, it's me first, and that I'm contributing to the decisions that you take at all levels.
Absolutely, Lilian. Thank you. Danielle, what treatment options are available for pregnant people? You're working with women's health and around this field. For pregnant women, those of childbearing age and who are lactating, what's the latest with this population as far as them being put first?
Oh, I think there's so much excitement globally around the need to protect women and other people who can become pregnant by inclusion rather than exclusion in HIV-related clinical research. It's quite the novelty to see where we've progressed in the most recent, 5 years, up, dare I say, 2 years, right? There's been lots of conversation and global advocacy that's really pushed the needle, pushed the envelope to get folks to consider bodily autonomy does not stop when one becomes pregnant. It does mean that you must respect a pregnant person's decision to participate in an HIV research trial. Period, full sentence, full stop.
Putting people first.
Correct.
Alex, what treatment options are available for pregnant people, those of childbearing age and those who are lactating? What is the latest for them?
Well, it's, as Danielle said, it's an exciting time right now. For a while, we've tried to figure out the best way to include pregnant women and pregnant people in studies, but there was not a framework that we could do that. But increasingly, there's some guidance and also buy-in from regulatory authorities and some documents that we can use to design studies. And thanks to the efforts of Danielle and Lillian, who are part of some of the GCAGs in the Purpose 1 trial. So this is a trial that is evaluating a 6-monthly subcutaneous option for HIV prevention. And we're borrowing from the advice from advocates and other stakeholders on how best to design these studies. We've been able to use their advocacy to actually include pregnant women in this trial and pregnant people, which means that if the drug is found to be safe and effective, this population will have access to it just like the general population. When you come to think about it, it's very counterintuitive to exclude pregnant and lactating people in these studies because they have a higher likelihood of acquiring HIV. So unfortunately, when you exclude them, it means that they have to wait a much longer time as you collect data in that population before they can actually access that new option, whether it's HIV treatment or HIV prevention.
Lillian, back to you for a minute. What do you believe a person-centered approach to HIV research and care looks like, and how do we achieve that? You've said putting people first means put me first. But when we talk about the care and how we, as it relates to HIV research, what do you think that looks like?
Yeah, it is about understanding that the person is an individual with so many needs, priorities, and that they change over time. And therefore, when you put them first, you're going to listen to them. You're going to make sure that you're not making decisions without consulting them, but also that you're going to take care of their different needs at different times. That, for example, if you're talking about a pregnant woman, today she may come when she's very happy. Mm-hmm. Tomorrow she may come when she has changed. And when you put her first, you're going to pay attention to all that. And that's why it is important that you even listen. So it is more about listening. It is more about giving more space to that person, to that woman, to that young woman, and making sure that you're not making decisions without them. So it is about them.
At the risk of really oversimplifying things here, this shouldn't be so difficult.
It should not.
This is not a difficult concept here. And I think we have a tendency to want to almost overcomplicate things. You know, when you have such a simple message like put people first, person-centered care, and you go, well, that is pretty straightforward, isn't it? And then people go, no, but there must be more. There must be more.
Why?
What's your take on that?
Why is always the first thing that comes to mind. Why should it be more than what it is? Yeah. When we say put people first, that means just that. Give an examination to the social and cultural context, consider those things, build clinical trials that support those lived experience. You'll have the best outcomes and the best chance of getting a sustained and meaningful uptake of your product, intervention, policy in the same populations that advised.
It's a win-win for everyone, right, Alex?
And it's doable. And,
absolutely.
You know, what's important is incorporating the voice of the people who represent the community, you know, at all stages of research. So in the Purpose 1 trial, we incorporated that voice from the early stages, even before writing the protocols. So GCAG, Community Advisory and Advocacy Group, looked at our protocols before we submitted them to regulatory authorities. They provided input on how to best execute these trials. They gave us things to do, ideas of things to do. They told us incorporate ways of monitoring for social harm. They told us include pregnant and lactating people in the studies. And a couple of other things that we actually put into our protocols, and this will provide very, very helpful information. So when you come to think about it, the advocacy to include pregnant and lactating people means if the drug is found to be safe and effective, it will be available as soon as possible.
To follow up on that.
It is about acknowledging that people are informed, they have information, they have knowledge. So you're not just coming. By the way, the things that probably you're looking out for, they already know. So when you make them feel that they are part and parcel, when you place them at the center, when they believe that you're trusting them, they'll give you all the information. They'll make your work easy.
Well,
It's
we say
that your actions also follow that, right? The GCAG is the manifestation of that trust. So it's not just a word and without action, but the implementation is what's most important.
And I know as someone, I'm obviously not a pregnant, lactating woman. It'll be shocking to you.
No.
But as someone who's, it's true, as someone who's living with HIV, though, I know knowledge is power. When I can understand something in normal speak that makes sense, I'm empowered. I feel good about myself. And that is a win-win for everyone. Alex, can you talk to me about...
But before you go to
Yeah.
Alex, I think what you are saying is very, very, very true, because many times people come, they think they have everything, they know everything, and then they forget that the person is more knowledgeable than they are. So when you really come with that, that is what people-centered approaches, even to research, means. That you're coming not as, you're acknowledging that you are coming as an expert, but the person that you're going to engage with is more informed, more knowledgeable, and therefore they are actually, at this level.
And it's about, I think it's a collaborative process,
It
again,
absolutely
between
is.
the healthcare provider, between the patient, and between, the companies like Gilead Science that are doing all they can to get on top of this. I want to talk to you, Alex, about some of the primary unmet needs that remain for pregnant people and those of childbearing age that you see.
So I think there's a gradual shift. So first was, how do you include pregnant women and pregnant people in studies? Now we're extending to other groups of people. How do you include a pregnant adolescent? Because that brings another curveball into 16-year-olds acquire HIV, or 16-year-olds or 18-year-olds have a high likelihood of acquiring HIV. So there's a shift again, not just in small spaces, but in regulatory spaces, in the community, of including, of coming up with solutions of how to manage more complex populations. And that will also contribute to, hopefully, ending the epidemic.
What about the children of these pregnancies, though? What's the outlook for children with HIV? You sort of touch on it a bit there, but can you go into that a little bit more?
So children, there are a couple of aspects with that. First, if you include a pregnant person in the study, you can answer that question faster. If that population has access to, say, a new drug for prevention, that person won't acquire HIV, they won't pass it on to the baby. Secondly, one of the other things we've done in the PURPOSE trials is include adolescents aged 16 and 17-year-olds. This is another population that has been historically excluded from studies. Now, that might not directly impact a young baby, but the way we do clinical research and approving drugs, you begin with an adult population, then you move to adolescents, then gradually, based off the information you have, you go to younger age groups. Now that we've included adolescents in PURPOSE 1, we'll hopefully have that data if it's approved. We don't have to go to adolescents, we'll go to younger ages, which means that the babies will get to an option for them hopefully sooner, especially as we come up with newer and safer and potentially easier options to use in people living with HIV.
Yeah, well, listen, Alex and Lily and Danielle, this has been a really insightful conversation. Thank you so much for making the time. It's been a pleasure chatting with you guys, as we dive into this putting people first. So I guess that was a look at community engagement side of person-centered care. But what are companies like Gilead doing to put people first? Well, earlier today, I caught up with Felipe Rogato, Executive Director of Global Medical Affairs from Gilead Sciences, to find out. Felipe, very nice to see you.
Good to see you too.
How's the conference so far?
It's going great, actually. It's nice to see everyone. It's nice to see community with a huge presence here. So,
is that one of the things that makes the conference so important? Community, scientists, doctors, us all being together?
absolutely. I think we all need to work together. We have the same goal. We want to reach the same place. And in isolation, we cannot get anywhere.
Yeah, and that same goal, there's been a lot of talk about person-centered approach. So what does it mean? Define what a person-centered approach to HIV research and care is, and why is that important?
So Karl, it's about reducing any inequity that we have in the system. And this could be related to how people, they see themselves in the system they are involved, both for treatment or for prevention. It's all around making sure that they can get the best therapeutic options, again, treatment or prevention that they need or they want.
So we've talked about the defining what a person-centered approach to HIV research and care is. Why is that so important?
So we need to make sure that we avert any new infection. We need to make sure that people, they get the prevention that they need. But also we need to make sure that individuals that are treated, they're treated for life.
Right.
And they are receiving regimens that are tolerable, that they have good forgiveness, good adherence, and the concept of U equals U, it does work.
Yeah, U equals U is such an important part, and I think that ties in with the whole putting people first theme of this conference. Can you tell me more about what Gilead's person-centered activations at AIDS 2024 look like and are?
Yeah, we're very pleased with the motto of the conference of putting people first, because this is exactly the alignment that we have with what we've been doing on how we are developing our pipeline and our portfolio drugs, both for treatment and prevention. We have quite a few good examples. We have a good presence from our folks that are willing to discuss and meet community and academics and clinicians to talk about it. We have 3 symposia here at the conference, and for those, we're trying to really break the barriers of inequity, focusing on testing, linkage to care, prevention, but also how to have people living with HIV, living their best lives with the best treatments they can have. So I think that's a good example. One other thing I think is worth mentioning, Karl, is we are launching during this conference a person-centric project with IS, so Gilead in collaboration with International AIDS Society, and that's going to be a project that will hopefully pave the way to reduce those inequalities by having that person-centered approach on everything we do.
Putting people first.
Yes.
Felipe, thank you very much.
Thank you very much.
That is going to do it for today's AIDS 2024 Day in Review. Of course, the breaking news never stops here at AIDS 2024. Be sure to tune in tomorrow to see more life-changing science that puts people first. And remember, you can like, follow, and share. We are at Plus Life Media across all social platforms. And remember to share your thoughts using the hashtag AIDS 2024 Plus Life. Until tomorrow, I'm Karl Schmid. Bye-bye.